Before we start with the procedure, I would like you to practice fulcruming with the syringe in your hand for each of the quadrants, just so that you get comfortable with holding the syringe, because it can be very awkward. And with this syringe, as you know, you have phosphoric acid in here, and we don't want it to go anywhere, like on the tissues or the gingiva. We want it strictly to go to the teeth. So what I encourage you to do is put the tip onto your etchant material, but don't bleed the lines. So this is going to be empty here. There isn't going to be any etchant material in here. And then come to the first quad and figure out where you would fulcrum if you were working on the 1/6. So I would fulcrum over here on the second quad, and then I could put my etchant material here. Notice I'm using my index finger in order to push my plunger. Sometimes you'll use your index finger, sometimes you'll use your thumb. So that's for the first quadrant. That's what I would recommend as far as the grasp for the etchant. Let's go over to the second quadrant. And you will see that I'm going to actually change my position. Right now I'm sitting beside the patient. And when I go over to the second quadrant, I'm going to be sitting at about the 11 o'clock position. So I'm just going to do that now. Here again, I'm going to use my index finger in order to push the plunger, and then I would place my sealant material on the 6. If you feel you're more comfortable using your thumb, then you could use your thumb. I'm just going to try that. I'm just going to switch my hand here. And for this one, yes, you could use your index finger to push the plunger, or you could use your thumb. Let's go to the third quad. And with that one, I'm going to move back to the side of the patient. I'm going to fulcrum. And here again, I'm going to use my index finger in order to push the plunger. We'll go to the fourth quadrant now. And I'm going to switch my grasp and use my thumb, in this case, in order to push the plunger to put the etchant onto the tooth. I would highly recommend that you practice the grasp and the fulcrum with your etchant before you start your procedure. And it's a good practice, just so you feel a little more comfortable when you're in the mouth with this syringe. Okay, let's start our procedure now. So for today, what we're going to be doing is we are going to be doing a sealant on the 2/6. And to begin with, what you do is you make sure you take a look in your patient's mouth, all around. Do they have any gum in there that you need to remove? Is there any inflamed tissues, tori? Just make a general observation. How are the tissues around the 2/6? And once you've done that, then you can take a little closer look at the 2/6, and you'll see that there's a lingual fissure. It goes onto the lingual from the occlusal, distal occlusal. And then you'll want to take a look on the occlusal and check out the fissures there. And then with our Explorer, we're going to actually check the vestibular to see if there's a buccal pit on it. We're going to use the articulating paper, and we're going to check the patient's bite to see where they occlude. Now, when you use your articulating paper, make sure that you use the metal part to the cheek, and then I usually just hold it on the maxillary, because the patient is always going to be biting, no matter if you're working in Mand or Max, they're always going to be biting into the maxillary. Then you'll ask the patient to bite up and down, and then rub side to side. You'll reach for your Explorer, and you're going to come in and you are going to check to see where are the blue marks on the tooth? And you can see how they're on the tips of the cuspid. They're nowhere, they're not down in the fissures, okay, in this area here. So at this time too, you take your Explorer and you check to see where your fissures are, and it comes right on to the lingual as well. And you check the vestibular, because sometimes there's a fissure that'll come onto the vestibular and it'll have a pit at the very bottom. And if that you have that on any of the teeth that you seal, make sure you clean it, etch it, and seal it as well. This time we're going to use the pumice, and it's just water and flour of pumice. Make sure that whatever you use to clean the teeth doesn't have any fluoride in it, because the fluoride will interfere with the setting of the sealant and it won't adhere to the tooth. Go to the deepest part and sweep up. Deepest part of the tooth, follow the fissures, and then make sure you get that lingual as well. Once you've done that, you want to rinse the area. And I press both the air and the water because it's quite gritty, and you want to make sure to get that grit all away from the tooth, those fissures that are going to get sealed. The type of isolation that we are going to be using today is the IsoVac. So in order to find out what size of mouthpiece we need to size the patient's mouth. And what we do is we look at the space between the centrals on the max and the mand. If 2 fingers fit in, and if only 2 fingers fit in, it's a small. If 3 fit in, it's a medium. And so today we're going to be using a medium mouthpiece. This is the whale's tail. You pull the whale's tail back like this. This part is going to go between the tongue and the teeth on the 3rd quad. And then the bite block right here is going to go between the molars in the 1st and the 4th quad. So we'll just be inserting it now. And then I'm going to slide the mouthpiece back over the molars. The patient can rest their teeth as I work on the opposite side. Isthmus is right behind the last tooth, and then the whale's tail helps to hold back or retract the cheeks. Once that is in place, you want to just make sure that that tooth that you're going to be sealing is dry. You would turn on your IsoVac, but for the sake of taping, I'm going to leave it off at the moment because it is very loud. Once the tooth is dry, then you can reach for your etchant. For the sake of taping, I'm going to be doing everything close to the mouth, but you would be doing this part over on the counter. You see how the tip is straight? In order to get better access to the teeth in the posterior, what you want to do is just bend the needle, and then it's going to be much easier for you to get back into the posterior area. Okay? And you also want to make sure that you bleed your lines, make sure that there is etchant material actually coming through. Good. So we want a fulcrum, and we want to apply our etchant material. And you can be quite generous with this material, not with your sealant material, but with your etchant you can be quite generous. So we're going to leave that on for 20 seconds. Make sure that you time it. The manufacturer's directions for this etchant says that you can leave it on for 15 to 60 seconds, but we have chose to go with the 20 seconds. Then what you want to do is you want to remove the bulk of your etchant material. We'll wash and we'll dry it. Remove the excess material with your HVE. We're going to wash and dry it for 10 to 15 seconds. For the sake of the taping, I turned the suction off so it wouldn't interfere with you being able to hear my voice. And now at this time, you're going to dry that tooth. On a real tooth, the tooth should appear chalky white. If it doesn't, then re-etch it for approximately another 30 seconds. Now we have our light cured sealant material, and because it's light cured, we are going to take our overhead light and just turn it back as we apply the sealant material to the tooth, because if we don't, it may start to set up prematurely. As you can see, I'm just applying a thin layer. Right into the deepest part of the fissure. This one goes onto the lingual. Some people will go in and they will take their Explorer and they will just trace those fissures, making sure to get it into all the areas. And then also it helps to break any little air bubbles out as well. Now I feel that I have a little excess, and I purposely did this so you could see I've got my micro brush, and I want to remove some of the excess material before I light cure it. So I'm just going to just place the micro brush in and lift it up. And if you had to do that a few times, you would just take and put the excess in your 2x2. In my case, I just had to do it once. Now we're going to light cure it for 20 seconds. This light has a timer and it only goes for 10 seconds, so you'll have to press the button once more. So it'll be 2 10-second in order to get your 20 seconds. So this light will harden your sealant material. You want to go in and check your work. So you're going to go over and trace the area where you sealed in the fissures. And it should be all smooth. If there's a bit of a catch or like a little hole or indent, what you would do is you would just bring your sealant material and you would just put a little dot of your sealant material and then light cure it again. You do not need to re-etch. The only time you'd need to re-etch is if it got wet with saliva. So that one is nice and smooth. Your next step is you want to come in and with the cotton applicator, you want to remove, there's a little residue layer and it tastes terrible. Just remove that for the patient and then give them a good rinse. We're going to take out our IsoVac now. Just grab a hold of the whale's tail, come this way, then take and lift your hand up this way in order to get the bite block off the teeth. And now's a good time to give the patient a tissue as well. We want to take our floss and we want to floss between the teeth, making sure that we didn't get any sealant material on the tooth behind or in front of it. If that happens and you seal it, then it forms a bridge between the tooth you sealed and, say, the one next to it. And then the dentist has to come in and remove that. So the floss went through the contacts nicely. We're going to check the bite again. And what you want to check is to make sure that there isn't any blue on your sealant material. If there is, then the dentist will need to remove it with a round burr. So as you can see, there wasn't any blue showing up. Shows up not on the tooth that you sealed. Before the patient leaves, you're going to take gauze and you're going to rub the blue marks from the articulating paper off. And you're going to instruct your patient to just continue to brush and floss. There isn't any special home care instructions for them. And this completes the sealant procedure.